Hello, welcome back to the channel. Today we're going to talk about a case that I actually saw recently that was really surprising. It was really subtle symptoms that ended up being a really bad disease. And this was actually a case I saw in the hospital. So this was a 60-year-old woman who had come in and she just said, I've just been having this really weird sore throat, but it only happens when I'm walking. And everyone heard that and said, a sore throat, why come to the emergency room? Why come in? But to this woman's credit, even though the symptoms were kind of mild, she knew something was wrong with her body. And she just was in tune enough to listen to get it checked out. Into the emergency rooms, doctor's credit, when he heard it, he said, geez, a sore throat, I don't know, maybe, I don't know. And he almost sent her home, but he decided to call me. And again, it just sounded so subtle and so mild, but we brought her in and we decided to run a bunch of tests. And it turned out she had horrible heart disease.
Wow.
Yes, she had 3 of her vessels in her heart, her coronary artery vessels, were almost completely blocked, and she was about to have a massive heart attack. So those symptoms of a sore throat when she was walking were actually her heart in really bad shape and about to potentially give out. She was about to have a major heart attack. So it was a great catch. She got treatment, had to go and have, a big surgery to fix the heart, but she ended up coming out and was great. But it just opened my eyes. These little moments happen sometimes. It just opened my eyes to, oh my goodness, you really have to pay attention to your body. And if your body tells you something might be wrong, you got to get it checked out because every now and then it might be something that you really need to act on.
Wow. Well, what a story, Dr. Ben.
Yeah.
Thank you for sharing it. And so much to touch upon there. Firstly, the fact that a sore throat was a presenting symptom of heart disease, and not just any heart disease. We're talking about 3-vessel heart disease.
That's right.
So often how this happens is someone will come into hospital, they'll have a stress test first, and then if the stress test is positive, a coronary angiogram, a cardiac catheterization will be done. That's obviously what found the 3-vessel heart disease, and she needed a heart bypass. Also, the fact that in women, it is well known that heart symptoms present slightly differently.
That's correct. They can be very subtle, especially in people that have diabetes. And yes, in women too, they can be more silent or more difficult to diagnose. They can appear much more asymptomatic or just have them present in kind of weird ways. So, that is a really interesting phenomenon that can make it difficult to know what's going on. So,
yeah. Where's Dr. Peter when we
I
need
know.
him? Dr. Peter's going to be jealous that we talked about this cardiac case, but so much to learn there. And the take-home message, I would say, is that you know your own body. When something isn't right, go get checked out. And another point here is, a sore throat. That was a very sharp doctor that got worried that the sore throat was worse when somebody walked. You wouldn't often think of that. Were there any EKG changes, troponins, blood tests?
No, there weren't actually. But what I would say that I give this ER doctor a lot of credit. He's one of the good ones. And he didn't like the way the woman described it. And he didn't like how concerned she had this feeling something was wrong. And he listened to that, which I think is really, really important for a doctor to say, hey, the symptoms, I don't know, they don't sound that serious, but this person says something's wrong with them. They never feel this way. And that means something because they've known their body their whole life. I just met them. So that has to mean something. And he took that very seriously. And I have a lot of respect for a doctor that does that really listens to a person and listens to, changes in their body. If it had been a different doctor, they very well could have dismissed them.
Very true. And then there's multiple parts to that. It is quite possible that the ER doctor might have been concerned, may have called the heart doctor or the internal medicine doctor and told a story. And they said, look, we don't think it should come in. That's another part. So obviously that doctor as well had some concerns and brought her in. And then she had a stress test. And yeah, it's really important to know your body when something is up and also be persistent. So often I've seen this.
Yes.
This has saved somebody's life, is that a doctor may have even dismissed something and somebody said, no, this isn't right. And you have to push, especially I would say often it falls upon a loved one, like a spouse, husband, wife, child, son, daughter, parents. Obviously will always be advocating if it's like a child patient, but My most common scenarios are a family member, like a husband, wife, or son, daughter, will be the one saying, my husband, wife, or my mum, dad is not right. This really needs to be looked at. And usually a doctor will be forced to listen because we know the truth as well, that we live in a medico-legal environment. And I think part of that is good, that there are consequences. We don't want to miss stuff, first because we don't want bad things to happen to people. That's the number one reason. But also every doctor knows that once somebody has really pushed hard, emphasized something, and it's all been documented, you don't want to miss anything. The other side of that is you practice defensive medicine, but obviously there has to be a fine balance here. But that lady had a lucky escape. How old was she roughly?
60.
60.
Yeah.
So yeah, not even that old.
Yeah, no. And it was just a great catch, but it was a really important lesson to me. I learned another lesson early in my career to trust nurses' intuition. So that's something that residents, when you're going through training, can learn the hard way. So if you ignore a nurse's intuition, something just doesn't feel right, you can really pay for that, because they've been doing it a while, a lot of the time, and they develop this sixth sense about something doesn't smell right, it doesn't feel right, and you got to check it out. So, listen to your patients, listen to people that have experiences, and you're more likely to help people. And for you, for you guys, listen to your body and be your own advocate. I couldn't agree with that more. I think that anytime we don't do that, we're putting ourselves at risk. So trust yourself, trust your intuition, and take care of yourself. Well, we hope you enjoyed that story. If you have any other stories or you have any comments, please leave them in the comments below. We love hearing them. We love interacting with you. Also, please check out our health and wellness store at ohiwellness.com if you're in the USA, or ohiwellness.co if you're in the UK. Please continue to watch. Please continue to come and see us, and we will speak again real soon.